Post-traumatic stress disorder is an anxiety disorder characterized by persistent re-experiencing of a highly traumatic event that involved actual or threatened death or serious injury to self or others. Risk factors include childhood trauma, such as physical abuse, sexual abuse, neglect, serious illness, school shootings, as well as other traumatic events. Risk factors in the adult population include terrorist attacks, natural disasters, fire, car accidents, robberies, plane crashes, hostage situations, physical abuse, rape, and date rape. Military combat veterans are also at high risk for post-traumatic stress disorder due to trauma such as prisoner of war, serious injury, death of a fellow soldier, combat experiences, close calls, and dangerous missions. Signs and symptoms of post-traumatic stress disorder include re-experiencing the stressful event, flashbacks, hallucinations, sense of reliving the event, intrusive thoughts, excessive verbalization of the event, verbalization of survivor guilt, feelings of shame, guilt, grief, anger, depression, anxiety, fear, and denial. Other signs and symptoms of post-traumatic stress disorder include increased arousal, neurosensory irritability, exaggerated startle response, agitation, disorganized behavior, poor impulse control, panic attacks, somatic complaints, changes in sleep habits, decrease in appetite, weight loss, and a loss of interest in eating. Psychological, emotional avoidance, and numbing symptoms of PTSD include impaired perception of reality, repression, confusion, dissociation or amnesia, impaired memory, feeling numb, detached or alienated, impaired personal relationships, and hopelessness. Additional signs and symptoms include altered behaviors, such as self-destructiveness, substance abuse, suicide attempt, thrill-seeking activities, personality change, a negative self-concept, and in children, enuresis. We will now discuss the role of nurses in dealing with patients with post-traumatic stress disorder. First, assessment. Use screening tools for post-traumatic stress disorder. Complete a comprehensive assessment for those who screen positive. Be sure to note the history of the time of onset, frequency, course, severity, and level of distress. What is their degree of functional impairment? Is there any suicidal or violent ideation? What is their family and social support system like? Evaluate for insomnia, social withdrawal, any current life stressors and medications. Also review their past medical and psychiatric history, as well as complete a mental status exam. Nursing diagnoses for patients with PTSD include anxiety, ineffective coping, social isolation, insomnia, sleep deprivation, hopelessness, chronic low self-esteem, and self-care deficit. Expected nursing outcomes for PTSD include manage anxiety by use of relaxation techniques, adequate sleep, and ability to maintain role or work requirements. Enhance self-esteem by maintenance of grooming and hygiene, maintenance of eye contact, positive statements about self, and acceptance of self-limitations. Enhanced ability to cope by a decrease in physical symptoms, ability to ask for help, and seeking information about treatment. As a nurse for a patient with PTSD, establish a therapeutic relationship. Validate in realistic terms feelings associated with the event. Provide non-judgmental acceptance and empathy. Assist the patient in managing an appropriate arousal level. Provide a safe and predictable environment. Teach strategies to manage anxiety. Connect the patient to support groups and psychotherapy. Listen actively and reflect back. Psychopharmacology includes SSRIs such as Prozac, Paxil, and Zoloft, SNRIs such as Effexor, TCAs such as Remeron, and Catapress and Minopress. as well as beta blocker Inderal. Treatment is considered effective for the PTSD patient when the patient recognizes symptoms as related to the trauma. The patient is able to use newly learned strategies to manage anxiety. The patient experiences no flashbacks or intrusive thoughts about the event. The patient is able to sleep adequately without nightmares. The patient is able to resume usual roles and maintain satisfying interpersonal relationships. Remember, not all wounds are visible. Everyone can be affected by PTSD.